Thank you for sharing your campaign video, your message, and your vision for PNAA. I appreciate the clarity of your platform and the spirit of service behind it. Your message about leadership being rooted in lifting others stood out to me. I also took note of your Aspire to Empower framework and your emphasis on achieving partnership, innovation, resilience, and excellence. Those are strong and meaningful words, and I agree that PNAA should be building a future that prepares Filipino nurses for the next decade. Because of that, I wanted to share a reflection with honesty and respect, and I'm going to leave out the name of the person who sent this for confidentiality purposes. As I listened to your message, I found myself asking what empowerment will look like in action, especially because much of what I have personally observed in PNAA over time has felt more aligned with status quo than transformation. At times, the organization appears highly visible, but not always deeply impactful. I want to meet this person. Really great insights.
Yep.
I see announcements, ceremonies, social media presence, and recurring traditions, but not always enough evidence of measurable movement in areas that matter most to members for the long-term advancement of Filipino nurses. For example, membership growth is often highlighted in terms of numbers, but I do not hear enough about retention, attrition, and engagement, renewal, or the actual experience and value members receive over time. Those fuller metrics matter because they tell us whether people are simply joining or truly staying, growing, and finding meaning in the organization. I have also wondered about how we define excellence and innovation as an organization. We have many highly accomplished Filipino nurses, including doctorally prepared leaders, educators, scholars, and executives. Yet, it does not always feel like PNAA consistently centers and elevates that depth of Filipino expertise. At times, it can seem that we celebrate image and external presence more than we strategically invest in our own collective intellectual and professional capital. Even in areas like ethics, where a committee exists, I did not meaningfully hear about its work until my third year as a member. That leaves an impression that some structures may exist, but their visible impact is not always reaching members in a tangible or consistent way. Another concern I have is that local chapter leaders do not always seem to be supported by specific national strategies, actionable tactics, or a clear operational roadmap. Without that kind of structure, chapter leaders may simply do what they know, repeat what has traditionally been done, or rely on personal experience rather than work from a shared strategic direction. Over time, that can unintentionally reinforce inconsistency, limit innovation, and preserve the status quo. I share this with respect because I believe your message invites this kind of question. I love it. Yep. If leadership is truly about lifting others, and if Aspire is truly meant to be a roadmap for transformation, then I would genuinely like to understand how your leadership would move PNAA from visibility to value, from structure to function, and from status quo to meaningful progress. If you are elected president-elect, what specific answers or actions would you take to ensure that empowerment becomes more than a message? More specifically, how would you help PNAA align membership strategy with deeper measures such as retention, attrition, engagement, and long-term member value? I really want to meet this person. Yes. There's more. Where am I? Okay. More intentionally, elevate Filipino doctorally prepared nurses and other highly accomplished Filipino leaders make committees such as ethics more visible, active and meaningful to members, provide local chapters with clearer strategies, practical tactics, and a more consistent framework for execution. Move beyond announcements and optics toward clearer outcomes, accountability, and organizational substance. Build a culture that is not only proud of its traditions, but also courageous enough to evolve. I ask these questions not to criticize, but because I believe PNAA can be more than visible. I believe it can be deeply impactful. I believe it can become an organization that not only honors Filipino nurses, but also more intentionally advances their voice, expertise, leadership, and future. Thank you again for your willingness to serve. I would sincerely value your perspective. A lot of really meaningful insight there.
Definitely, Kim. And as I was reading this email, wow, I find, first of all, my profound gratitude to all of these great members, because they really take time to share their perspectives, their wonderful insights, right? And that's why I want to create this platform to be able to share my insights with some of these. First, I think it's very clear that people need to understand what aspire means, right? And as you've noted, Kim, this Aspire platform was born way back when I was president of PNAA New York, because first, I believe that the power of empowerment, right? And aspire means achieving synergistic partnerships, innovations, resilience, and excellence. And if you try to dissect the word achieve, right, it's very intentional. It's a verb, it's an action word, right? And when we act, we want to make sure that that is measurable. So it should be premised with clear goals and objectives. And I love what he's talking about. How can we ensure that there is an ongoing communication and that our members truly understands where we at with our membership, for example, right? So we need to be driven by data. And I think that's an opportunity for us as an organization, right? We need to truly understand the demographics of our membership, right? How many of this belongs to this generation, right? Because we want to make sure that we're catering the needs and the aspirations of the members across the continuum. We need to understand the attrition, right? As we work in health systems, in acute care settings, we always try to engage our patients, right? That's why we do those patient engagement or patient surveys. So we want to do the same thing in PNAA, right? Because this is a membership organization and we owe it to them to listen to what do they need so that we remain relevant as an organization. The second piece is synergistic partnership. I love the word synergy because it connotes beyond collaboration, right? It's not just us partnering together, but with a commitment to deliver results, right? And with the current climate, we have a great opportunity to tap some of the stakeholders of healthcare. It's starting with our academic partners, right? Working as Vice President of Nursing Professional Development and Practice Excellence in one of the large health systems, I see the value of academic practice partnerships in creating pathways for our colleagues. But that is translatable also to our members. So we need to open our gates. What are our pipelines for PNAA membership? How can we create avenues for associate degree nurses to become BSN, right? And I know that some of the chapters had opened their doors for LPN. That could be a possibility. and create the opportunities. How can we assist and support them to become BSN and fulfill their dreams to become professional nurses? And with all of the resources that we have from P3, right, we have a cadre of PhD, DNP prepared Filipino nurse leaders. How can they serve as mentors so that we can continue to grow those educated, highly educated leaders? Because we know that a lot of our members are aspiring to become faculty members, to become researchers. So we need to tap those resources. And partnership that goes along with that in terms of all of the advocacy work that we're doing. How can we expand that, right? To address the disparities among Filipino American communities, not just here in the United States, but also think back and close those disparities back in the Philippines. And innovations. I think we're well positioned now with all of the opportunities in terms of integrating technology, right, in innovations and trying to streamline our processes. We can do the same thing with PNAA, right? Bring innovations to cultivate engagement. How can we mobilize all of our social media platforms, right? How can we digitize some of our operational transactions with PNAA? And of course, R is resiliency. That is bringing joy to PNAA, right? And we do a lot of celebrations. But to his point, how can we make it more meaningful, right? How can we make it also available to the members? And the last one is excellence. This is so critical because this is fundamental to our organization. How can we infuse the culture of excellence? And excellence should start with us, right, as members. And that is very thoughtfully outlined in our credo. I hope everybody had a chance to read and reflect on our credo. To me, excellence starts with me, with you and I together, trying to embody that commitment to the organization, right? The commitment to advance ourselves and be able to contribute not only for, again, for our patients, for our families, for our teams, but overall for the communities that we serve. And that goes along with building our infrastructure, right? How are we preparing our leaders at the chapter level? How can we equip them with competencies? Do we have onboarding practices, right? And it goes also to the individual members. The work that we're doing now with internationally educated nurses. How can we assist them as they integrate themselves in the United States? So those are the things. It's broad, but I want to share with our members that there are some tactics, strategies where we can easily operationalize the Aspire platform.
Thank you, Kuya. You know, what you've said really speaks to what you've been telling me from the beginning of this interview, that leadership is a science. And you know, based on what you've been sharing with us, is that you wanted to ensure, and you actually recognize that PNAA is evolving. The needs of the members are dynamic, and that it's different, and that's why the leadership that you offer to our members is a leadership backed by science, because it truly is. Leadership is a science. Yes, it is an art, but also it is a science. The organization should not assume what the members need, and the members should be able to shape what the direction of the organization, because you know, you're running for the members, you're running for the community.